Hello, everyone, and welcome back to Psychology Eats. So, what's eating you? Well, we are now facing, as you can see from the title, the second wave of Corona. COVID 19, Rona, whatever you want to call her. But we are in the second wave. And so with that is bringing about lots of mental health issues. And people who never even had anxiety or depression clinically are now finding themselves in these long periods of depression or long periods of feeling anxious or nervous, maybe even experiencing panic attacks. And this is all new for all of us. I mean, this all started in March of 2020, and we're going to soon be a year, dealing with social distancing, dealing with wearing masks. Go check out my video on masking or not masking. But we are in a point now, they're calling this the second wave. And I, as psychologists, psychiatrists, clinicians, we are concerned about people emotionally. Where are we emotionally? I think it's normal for a lot of us to feel depressed, anxious, fearful, because we don't know, like what the outcome is going to be. Although we're hearing some really good news about vaccines that may be available to people in the very near future, for a lot of people, they're still fearful of that, of this vaccine. But even with or without a vaccine, it is what has happened. There are over 250,000 people who have passed away as a result of COVID-19. And so now we're dealing with those people, the family members who are left grieving their family member, and grieving in a way that they are kind of like have to face it almost every day through the media. You see something on TV about COVID-19 and your family member died of it. Now it's like it comes rushing back to you. There, families who have lost multiple people within the family from this virus. And so we know grief people go through the stages of grief, years. It could take you a lifetime to go through grief and the stages of grief. So for most of us who are just praying that this comes to an end, we are still very much in the throes of this second wave of this coronavirus. And so the uncertainty of when this will end is affected a lot of people, millions of people. And it's showing itself through depression, anxiety. Some people are, isolated. There are some people who haven't really been out of their houses since March when it started. That they are really still stuck in their homes, dealing with this or trying to avoid being infected by this virus. We can watch now. People are posting their stages that they're going through when they're sick, and it's horrible. It's really scary. So I would say that if you are dealing with COVID in a way that you've been infected by it, or you've had a family member and you actually had it yourself, or a close family member, or you're just fearful, that you should reach out to somebody in mental health to help you kind of get through this, especially if you are having like panic attacks, anxiety attacks, depression. in a way that you're not able to function in a normal way that you did prior to feeling this depression and anxiety. So I would just say, just have self-awareness. Where are you as far as your mood, your behaviors? How are you managing all of this? And really, above all, be safe. Take the safety precautions. If you haven't been, sick yet, or not yet, if you haven't been sick, great. Then you're probably doing the right thing. You're wearing your mask when you're in public. You're not going to events that people are not wearing masks. You're using hand sanitizer. You're just making sure you're being safe. And because of that, you have been safe, and that's great. Stick to that routine that you've done. And hopefully we're going to get through this soon and we can get our lives back to normal. But right now, we are in the throes of this. Even like right now, you saw me, I did this, but I didn't go, in my mouth. But it's scary. It's scary. It's changed the way we operate in our day-to-day life. So I would say reach out, find someone that you can talk to. If you don't have insurance, you can call your county mental health, not workers, but office, your county mental health office, and see if they can provide you with some sort of free counseling. You can call, different hotlines. Sometimes they can give you a quick, kind of boost and some techniques and things that you can use to kind of get through this. So that is it for this video. Be well, wear your mask, and stay safe. Don't forget to like, subscribe, and share with anyone and everyone that you think could benefit from this video. Thank you.